Hello and welcome to that Larimer County Show. Today we have a show that I think all of you would be interested in. All of you would probably be touched in some way by this, and by the end of the half hour you'll see why. We have a good panel who's going to talk about mental health and substance abuse, a subject that could be, we could have been talking about this in the past, we could be talking about it today, and in the future, it's always a relevant topic. And so we have Laurie Stolen, who is Director of Alternative Sentencing, Larimer County, correct? And then we have Peggy Reeves and Cheryl Olson, who are co-chairs of the People for a Healthier Larimer County. So welcome to all three of you.
Thank you.
Thank you.
The first question in setting all this up is, Larimer County is a great area. We have a lot of amenities. I think most of us would think that issues such as substance abuse or any mental health issue is something that is already taken care of. We have Summit Stone, we have a couple of great hospitals. So what's missing and what are we here talking about?
That's a really good question. So we've spent a lot of time trying to find out where the gaps were. And we've got some great partners that we've been working with, and we have to give a lot of thanks to the Health District of Northern Larimer County for contributing a significant amount of money for a study that we hired some national consultants to come in and actually tell us where the gaps were in our behavioral health system. So we've spent about the last 9 months looking at where those gaps were, and we did that by looking at what we did have in really good quality services in our community. And what we found out were where the biggest gaps were was in a detox center. Mm-hmm. Our closest detox, as you guys know, 35 miles away over in Weld County. Larimer County doesn't have a detox of its own. People have to go to the ER. Oftentimes they end up in jail, or transportation somehow has to get them over to Greeley. Mm-hmm. Another place that we've got some gaps in our services are in acute treatment. Folks that have mental health crisis that don't quite need inpatient psychiatric hospitalization, which we all know is very expensive. So we need an acute treatment unit here in Larimer County. We don't currently have one. Another place that there's a big gap is in substance abuse treatment on the residential side of things. Currently, the only place that you can get residential substance abuse treatment is if you enter the criminal justice system. Our community corrections department has an intensive residential treatment program there. So we'd like to see us not have to criminalize folks that have substance use disorders in order to get the treatment they need. Some other recommendations that the consultants made were in areas that maybe we do have some levels of service, but we don't have enough. Mm-hmm. So outpatient is an example. We could probably triple or quadruple the amount of outpatient services that we have. Mm-hmm. There's also not enough permanent supportive housing. We're looking forward to partnering with the housing authorities in the county and connecting with them if they are able to build permanent supportive housing structures, that we may be able to partner with them to provide the staffing to support the case management needs that they would have in permanent supportive housing. So, like you said, we've got a lot of great services, and we've identified some significant areas where we've got some pretty big gaps that we'd like to solve.
Mm-hmm. So Peggy and Cheryl, why are you involved in this?
Well, I think for those very reasons that Laurie is mentioning. I mean, we've got fantastic service in terms of our physical health, and we've got great services in some areas that deal with mental health. But if you really care about the community and you want us to continue to be the best we can be, then I think it's important that we ask the voters to help us make that happen. Mm-hmm. So, and like everybody else, not like everybody else, but like most people, I happen to know people who have had problems, and if only the right services had been there, maybe they wouldn't have gone down the path of jail and prison. Maybe they would have gotten the treatment they needed as opposed to where they ended up. Mm-hmm. And so we can really do a cost-effective job mm-hmm. here in Larimer County and meet the needs of people. And as we like to say, we want to have the right service at the right place at the right time and at a good price. Mm-hmm. We want it to be something that we can afford. I mean, it's crazy to have people in the jail and in the psychiatric hospital, the most expensive places to be, when they are better treated and get better help and get stabilized, and then you can have a plan for them long term.
At less cost.
At less cost, if we just get going and do it.
I think that's a biggie that we want to point out to our viewers, is that even our sheriff would agree that most of the people that are in jail, and you probably know this, probably have either a substance or mental health issue, substance abuse or a mental health issue.
It's a really high percentage.
High percentage, and if they were treated prior to,
They may not need the criminal justice system as much as they are now.
right,
And the
okay,
other place we take people, Neil, is to the ER. And, you know, they might get stabilized, but you don't stay in the ER.
Right.
And there's,
you go back
then
to
they-
whatever.
You go back, and so the cycling through is one of the things that's really hard.
So then that's another piece, is that what we're doing now is not permanent. I mean, it's kind of a
Yeah.
Band-Aid approach.
And it doesn't have great outcomes.
It doesn't have great outcomes, right?
And we've been working on this since 1999 when the Community Mental Health and Substance Abuse Partnership was formed. That's a group of executives from service providers in mental health and substance abuse, and worked a long time to coordinate services, to streamline things, to stretch every dollar, to use it more wisely, to provide more service. So really where we're at today, Neil, is that these are the gaps. It's not, we've done everything we can do to use all the money that comes into the system to provide the best services that can be provided. But it just would be so much smarter to have these services available than to send people to the jail or the ER or home where there's nobody and nothing. So to me, it's about spending the money and having a better outcome.
Right, right. And you know, making it very, maybe too simplistic is when you have an issue, you might have, and you think that you've been, because you've gone through maybe one day of rehab, you're going to go back to your friends who
Right.
are still, and
Yeah.
who may be also indulging if it's a substance abuse issue, or you don't have that support if it's a mental health issue. You know, you're having the same type of people who might,
Right.
Right.
who are not of help. So what is the solution? So we know we've established there's a problem. What's the idea? What are we going to do about it?
So there is an executive report that was written from the consultants, Niatex, that we used, that submitted us a report that basically outlined the numbers, the size of what we would need to fill the most critical gaps in our community. And it basically outlines the number of beds that we'd need for an ATU, acute treatment unit, 12 beds, 12 beds for a medically monitored detox. And if I could just kind of explain a little bit about
Sure.
the detox piece. In Greeley, that's a social detox. They don't provide the medical services to give any medications if they were needed, to monitor someone if they have a medical issue. They'd need to be sent to the hospital if that were a need. So it's kind of just a place to sober up. And then they send them on their way without those wraparound services, or that ongoing care. So they've reduced the tolerance of someone on the drug or the alcohol that they had in their system. And unfortunately, without those ongoing services, sometimes what happens is that when the folks go back out and they use again, since their tolerance has been brought down, they have a higher tendency to overdose than they did the first time. So there's, on the different levels of detoxification, you've got the hospital, which is like a medically managed, expensive, and then there's medically monitored, where you can be supervised by medical staff, and then there's social detox below. Our consultants have recommended that we would have a medically monitored level of detox here. So we've got the beds for detox, and then in this facility that they've scoped out to be around a 50,000 square foot facility, would have the acute treatment beds, the intensive residential treatment beds for substance abuse, and then the detox beds. And then another exciting piece of what the consultants recommended for us is really what we call beyond the building. That it's truly an integrated system of care, that it would connect with all these partners in the community and make sure that folks had what they needed from a thorough assessment up front to really identify what all their barriers to success and stabilization are. Clear through like a permanent supportive housing model. And so we're visioning a campus where this facility would be, and then dental care if needed, vision care, maybe a permanent supportive housing structure where really they could have all the services that they needed in one place. It would make sense. There's some budget money available for folks if they can't afford the copays or the deductibles for the services. We really want to remove the barriers to access for treatment. When we've talked to the private providers and the other service providers in the community, ultimately what we found out is nobody can really afford to do what we're looking at doing. We kind of want those people that can't afford to get the services at any place here in the community right now. So our ideal would be a mid-county kind of location, where it would be equally accessible to all of the municipalities in Larimer County. We know that this just isn't a Fort Collins problem.
Right.
It's not just a Loveland problem. We also realize that our smaller municipalities could certainly benefit from this as well. So we're looking at a mid-campus, mid-county campus, 50,000 square foot facility. Ultimately, we're looking at about $20 million to build it, and an annual operating budget of around $16 million. Fortunately, Medicaid, Medicare are expanding some options, and we're hoping that when we get this budget all put together, we could find around $4 million worth of payer sources to help contribute to the funding of this ongoing operations of the building. We hope to leverage every dollar that we could find through other payer sources, through other agencies, to encourage other folks to expand their services to really balance the needs. So ultimately, we're looking at about a 0.25% sales tax that the people for Healthier Larimer County are going to go to the commissioners on August 2nd and ask them to refer it to the ballot this year, November of this year. And we're looking at really getting this thing passed. We're very excited.
You know, Neil, we know that treatment works. We know that if you can catch people early on in their mental health or substance abuse disease, treatment works, just like it works for heart disease, for diabetes, for cancer. You know, there's a new slogan out that's like before stage 4, because most people don't get treatment until they're at stage 4.
Correct.
They're in a real crisis with their mental health and substance abuse. So the earlier we can catch them, assess them, get them into treatment, we know it works better, and they can have productive lives and be productive members of society, just like other diseases
Right.
that people
And
have.
we're aware too that people, when they're ill, they can get cured to a certain point, and get stabilized, but they may have relapses. So we understand that, and we know that once somebody's treated, that doesn't mean that they're just left to their own devices. We need to be sure that we can keep them stabilized and that they don't really fall down to the lowest level again in terms of their illness, but that we take care of them just like we take care of people with heart disease and with cancer.
So that's part of what wraparound means, is
Right.
that ongoing.
Right. What I hear is that,
Yeah.
we don't want to do a Band-Aid. We want this to be comprehensive. So if someone's going to enter this, we're going to do the right thing, and that person can go back and not, more than likely is going to be fully functioning and not have to return or go back to their old ways.
Yeah, and the goal will be to catch them early. Once we start seeing them become unstable again, they catch them quickly before they fall into the need of these higher intensive, more costly interventions.
So the first thing that anybody gets is just an overall assessment that will include people that can assess the mental illness side and the substance abuse side at the same time, not just looking at one or the other, but looking at both and kind of determining, what treatment they need, if it's co-occurring, having both, or if it's just one or the other, and then provide the right treatment at the right place at the right time. And
Right.
it can be
And you
very
don't have to-
exciting.
I think one of the things that's critical for people to know too is this is not just for people who end up in the criminal justice system or just people who are on Medicaid. It's for everybody, because even if you have great insurance, you can't find the treatment that you need. So, and maybe you have great insurance, but you can't afford your deductible or your copay. So,
Well, you have great insurance and there's no place close by.
correct.
Yeah.
I mean, I have friends who sent their daughter to Florida
Right.
because that's where they could get
yeah.
her the treatment she needed.
Exactly. So, and most people don't even think about that. They just live with it, thinking that there's no easy answer.
Right. Right.
So, how would you describe the change? Well, let's just take a hypothetical. How do you foresee the change in Larimer County by just having this particular building and the services?
I wish we had someone from the police department here. I think there's some of the most excited people thinking about the change, that they would actually have,
A place to take people.
yes, besides taking them to jail when they know that they're not going to get what they need at the jail.
Because right now that's what happens to people. They go into crisis, whether it's, they're having a psychotic problem or they're having a substance abuse problem. They're in a crisis. people who love them don't know what to do. They dial 911. What do you get when you dial 911? You get a policeman or an ambulance. So you end up, they take you to the ER or the jail.
Right.
One, if you've committed a crime while you're having your crisis. One, if you're not. And that's not, I mean, that's just a temporary solution. Keeps you safe,
Right.
people around you safe, but it doesn't.
Well, I could just, you know, again, going hypothetical, married couple, frustrated spouse, whether it's male or female, starts really getting wild and banging on their furniture and putting a hole in a wall, and a policeman will come to that house. You're right. They're either going to take me to the hospital or even to the jail because you've done some destruction. Well, this person, if they were on medication or went through whatever the issue was,
And they might have actually, Neil, gotten to that place because they didn't
Get earlier.
get earlier help
Right.
because there was no place to go.
right.
Spouse may have wanted to get them help, may have tried to find them help, but the help wasn't available.
And
So
the person that puts their hands through a wall is actually asking for help.
Yeah.
yeah, screaming
know,
for help.
Yes.
And we talk about suicide a lot in this community.
Yeah.
And what if you think that someone in your family is suicidal? You know, what do? You know, this will be a place that they can go, or if they're, you know, if they're really getting out of control and they're psychotic in one way or another. But I think it's going to make for all folks in Larimer County just to have a place where you know you can take someone if you're really concerned about their behavioral health or their mental health.
Right.
It's going to be a real life changer for, I think, many families.
And I think
Right.
the fact that national conversations are going on about this, it really lends to it being a viable time for us to make a change in our community.
Yeah, as I said before, it's a problem that hits you every day. It may hit you directly, or you read something in the newspaper where it's happening somewhere else. But you know, I think it's foolish. This is my words, and I'll take responsibility for saying this. But any family or person that says it's not in my family, I would challenge that. I'd put one of those $1 million challenges and say, you know what, you're wrong.
Yeah. The
'Cause it touches
statistic is
everybody.
1 in 4.
Yeah.
And, you know, really, I mean, I've been in small meetings and large meetings, and I've sat there and I've thought, I wonder who the 1 in 4 is, you know? Because you just know there's people on the edge. There's that, you know, it doesn't.
And our goal is to expand these conversations to really try to reduce the stigma. You know, there shouldn't be any shame in reaching out for help. There shouldn't be.
And it's not only adults; it's children. So tell me, is this going to include the kiddos?
So we know that there's issues on the kids' level of things as well, and honestly, the health district and the county as well realize that the kid issue is unique, and we've decided to make it kind of its own track. It's so important that it kind of deserves its own undivided attention. So the health district is doing great work on the fronts of children and adolescent youth programming right now, and we know that there are some credentialing issues and standards by state statute through the Office of Behavioral Health that you can't really mix populations in the kind of facility that we're looking at.
Right.
What we would hope to do is in this integrated system of care that we would make sure that there was a good referral source. We know that these issues affect families, and oftentimes if a parent is struggling, the child sometimes struggles as well. So we want to make sure that we've got those good connections to schools and communication, making sure that if we identify that there's a kid that's in trouble that needs some support, that we would connect them to the right level of service. But ultimately, this project really is focusing on the adult population.
The other thing I think that's probably important to communicate to certainly our voters is that this is a sales tax that is going to be proposed to put on the ballot. You know, no matter what, a number of people are not very comfortable in voting for sales tax. They may argue that the private sector should be taking care of this, or they just don't understand the value. So what would you say? I mean, if you really want to let our folks be informed that this is the right thing to do to pass this tax, what would you tell them?
To me, I would say we're already paying.
Yeah.
We're paying, you know, those of us with insurance are paying for those who show up at the ER who don't have insurance or who end up there. As the citizens of Larimer County, we're already paying for for the jail space, so we're already paying. And what I would prefer is to pay for something that actually works better and has a better end result. So you're right, there are people who just don't want to support a sales tax. But actually, Neil, it's been pretty surprising to me as we've gone out and talked to people. People are really understanding the need. And one of the things I like to talk about is that we have been working at the private sector, at those already in business, those agencies who are already providing these services. We've been trying to stretch dollars since 1999. We know these are gaps that there's no money to fund.
I'll even
So-
add to that and say that communities have been stretching their dollars since they were burdened with taking care of folks in a community mental health capacity since deinstitutionalization, since it became unfunded in the late 50s. And the feds decided that they wanted to transfer those dollars from state psychiatric hospitals to more of a community mental health model, and that never happened. And so communities around the nation have been struggling to figure out how do they stretch their dollars even farther to take care of their own in their communities with mental health issues. And this is the time to say we're going to change the model.
And this is a real need, you know, and it's not just something you would want to have, but it's a real need. And if we would have it, if someone else had already done it, it would be here already. So when people say, well, let the private sector do it, well, the private sector financially
done it,
can't do
right,
it.
right.
They're doing great work in many areas, and we intend to continue working with them, collaborating, partnering, and hopefully it will, you know, raise all boats in terms of the level of mental health
Right,
care.
right.
Just like how great we're doing in terms of cancer care and those kinds of issues here in Larimer County now. We can do the same with mental health.
Right.
Yeah, there's 62%, is that right, of the people in the detox in Greeley are Larimer County residents?
Yes. Yeah.
So if there was a way to build that in Larimer County, it already would be here.
Right.
Right. Well, it's a community problem. The community should solve it. And you know, I think that speaking for just one person in the community, I'm proud that that the three of you are working on this, and wish you the best of luck. And I guess
you.
we'll find out.
thank
So,
Thank you.
anyone want to make any closing comment? I mean, this in terms of
She can't say it, you can't say it, but we
We
can
can
say
say
it.
yeah.
Vote for detox mental health in Larimer County.
Okay. Well said.
You'll have your chance in November.
Yeah.
Good.
Open
Good.
your ballot, look for that issue, even if you don't want to vote for anything
Right.
else.
So it was
And somebody said, don't get too exhausted before you get to the end of your ballot.
That's right. Yeah.
and as we say in Chicago, vote and vote often.
There you go. There you go.
Okay. Well, thank you all. It's been a pleasure, and that's it for this edition of That Larimer County Show. We'll see you the next time.
Thank you.
Thank you.